Yes, we are live.
Hello, everyone. Thank you for joining us today for this important webinar on advancing health for all. My name is Teresa, and I'm the host of today's webinar. This topic is so important because good health is a right that everyone deserves, no matter where they live or who they are. Yet many people around the world still struggle to access the health share ways to make healthy care more fair and available for everyone. I believe that by working together, we can create solutions that brings real change to our communities. And today we are honored to have Shamira Sukka, a healthy economist specialist, with us today. She will share her expertise and insights on how we can improve our health to save everyone's better. Over to you, Ms. Shamila.
Thank you, Teresa. First of all, I want to apologize for not being at the office for this presentation. I had an unexpected emergency that required my attention. So I'm joining this through my phone and I just couldn't miss this. So I said I'll join wherever that I'll be. Yeah. So my name is Shamira Sukka, as Teresa introduced me to you. I'm a Tanzania Women Ascension representative. I'm a health economist, and today I'm honored to speak as part of Women Ascension's outreach efforts. So this webinar is about creating a shared understanding of health and well-being and exploring on how we can collectively drive a positive change in our communities, especially in the area of health. Yeah, so I'm going to share my screen. Can I, Teresa? Can you hear me?
Yes, please.
You can do it, ma'am. Yes, you can do it.
Okay. Can you see my screen?
Yes, we can.
Okay. First of all, I want to start sharing with you why health awareness matters. It matters because it is the foundation of a better health outcomes. Like when people know about a certain disease, how the disease is spread, and how to prevent the disease, they can make an informed decision about their health. And in many communities, a lack of awareness, it can contribute to preventable diseases, unnecessary suffering, and in result, it can sometimes cause death. So with all these efforts of raising awareness, we empower individuals and communities to take charge of their health, which is very important. And lack of awareness can cause many negative impacts on health. For example, because we lack awareness on health, we can be ignorant on the preventive measures. So people may not know about a very simple thing, which can be a very cost-effective way to prevent a certain disease or infection, such as maybe that measure can be a vaccination or just a simple act like hand washing or using mosquito nets, which both can use it to protect daily illnesses. But also when we don't have health awareness, we can delay in diagnosis and treatment of some diseases. So without awareness, individuals may not recognize early symptoms of a disease, which may lead to delay in seeking medical care and also can worsen some healthy conditions that can be life-threatened if not treated earlier. And also, if we don't have enough health, we are not aware of some health matters, we can have health misconceptions, misinformations, or cultural beliefs can often lead to practices that can increase risk of diseases, such as in some communities, they reject medical interventions just because they muchly rely on traditional practices. So that can be a risk action because it can like put your health in danger. And also failure to adapt health lifestyles. So when we are unaware of the link between our lifestyle choices and the chronic illnesses, it's more likely to get the NCDs like diabetes, hypertension, and heart diseases. So those lifestyles such as diet, physical exercises, and smoking, if we don't have the clear link between our lifestyle and the chronic illness, it can be like a threat to our health. Okay, challenges in health awareness and promotion. So there are many challenges that hinders the implementation of most health awareness promotion. Such includes the cultural beliefs that discourage people from seeking medical help, and also limited access to healthcare, especially in rural areas. They're not the healthcare is limited to some places. So some households are living very far from the health facilities so that they cannot access timely the health services whenever they need. For example, in many places, there are cultural stigma around discussing mental health. You know, I've seen communities where people are suffering from depression or anxiety are labeled as lazy, sometimes possessed, just because the society, the community doesn't have enough information about depression or anxiety. So those people are being prevented from seeking help just because they are being labeled as lazy and possessed. So addressing these misconceptions is a key challenge we must tackle so that to improve the overall community health. Also, lack of trust in health systems, because sometimes it's not about the availability of the health services, but also there are some communities that the the individuals in those communities doesn't trust the facilities in providing the health services to them. So that one is also posed as a challenge in health awareness and promotion. Strategies for effective health promotion. There are several strategies, but I'll talk about like 2 or 3. So in overcoming these challenges, we need to be innovative and also to be effective so that we can achieve the goals that can improve the overall health of the community. So these strategies should involve the community provide education to them in accessible manners, and also to leverage the use of technology to reach as many people as possible. So when all these three approaches combined, they can create sustainable change in the overall health of the communities. Okay, so in community engagement, for example, we can use the village elders to use them as the health ambassadors. Like there are some communities, even here in Tanzania, are using the traditional storytelling to share health messages. Like they're telling the communities about maybe malaria or HIV. So they create this environment of like telling them a story about a disease while educating them, which increase the awareness among the community. But also in education, we can use these strategies in school to teach children the basics of the diseases, like what are the symptoms of a certain disease. But also we can teach children on the basic hygiene practices like hand washing, on how hand washing can help reduce the spread of waterborne diseases. So through education, we can impact knowledge to those children, which will help them to sustain against certain diseases. And also technology. So by the use of technology, we can leverage the health awareness through the mobile apps, the social medias. We can, by using those technologies, we can reach a lot of people in no time. Like you can send one message on how to educate a certain community on a certain health issue, and that message will reach that community in just a matter of seconds. So that is a way to improve the health awareness. And another thing is the role of collaboration. So collaboration between okay, so the promotion and effectiveness, as I spoke before, isn't something that only individuals or only organization or only government can achieve. It requires the collaboration between the governments, NGOs, private sectors, local communities, and individuals to work together so can achieve a similar goal. For example, by working together, we can pool resources, we can share knowledge, so that we can create impactful initiatives together, like the government, the NGOs, the private sector, the local communities, and the individuals as one. If all of us takes charge into it, then it will be very easy to spread the information about health and to have a healthy communities. For example, if I take you back, when the Ebola broke out in West Africa, the response required collaboration between the government, the NGOs like doctors, local leaders, like to educate the individuals in the communities on how to avoid the spread of the disease. So together they implemented measures like contact tracing, community education, and together they helped contain the outbreak. Yeah, so call to action. Now that we have discussed the importance of health awareness and strategies for health promotion, the question is, what can you do? Like, each one of us has a role to play in this, in creating healthier communities, whether a small or a big change, but every action counts. Each one of us has a role to play. So you might call a small change, but it counts in making a bigger change. So you can start small, like you can organize a health talk. You can share a verified health information on social media. I emphasize on verified information because when the health information is not verified, then it's become a threat to our health. Yeah. Also, we can volunteer for any health drives that's happening in our community. I remember I once or twice worked with a group that organized free health screening at a local market. And another one, we went for the primary school to screen children. And it was all the intervention was the turnout. The turnout was very amazing. And many people learned about conditions they didn't even know that they had. So that was a very major thing. And in conclusion, so advancing health and well-being for all is a journey. It's a journey. So it requires awareness, innovative strategies, and collaboration, as I said earlier. And together, if we collaborate, the individual, the local communities, the government, and the NGOs, together, if we can collaborate, we can build a stronger and a healthier communities, which have enough health information and they know about disease and how to go about it, its symptoms, how to get cured of the certain diseases and so much. Yeah. Now, I would love to hear your thoughts. If you have any question or you want to share your own experience on the matter, please welcome. Thank you.
There is a question in the chat box. It says, if we are not majored in health, but we are community leaders, how can we prepare ourselves for such outbreaks in future, which is always unpredictable, but we need to be ready to support our communities?
Okay, let me go to
How
the
can
chat.
we do?
You're not majored. Okay. As I said, these changes, the goals that we have, can only happen if we work in collaboration. Because we're talking about health. I myself am not a doctor, but I can participate in intervention like that because I can use my expertise as an economist to know the cost-effective intervention to intervene in a certain community. So same as you're not majored in health, but you are a community leader. Community leader has a very much importance in communities because they are the one who will conduct the local gatherings. Because in our communities, most of our communities, we muchly respect the community leaders and the people in our communities that has influence. So it's very important to collaborate. So you can collaborate by just organizing people together. But a doctor will come to those people to talk to them about a health condition. So it's a matter of collaborating.
Thank you so much. And earlier you mentioned about mental health, things also may be struggling with their mental health.
Yes, I missed that. Please, can you repeat, Mahi?
How can we better support our peers, friends, or families who may be struggling with their mental health?
All right. So it first starts with us as the individual. Because sometimes it's even hard for an individual to figure out that they have anxiety, or they are depressed, or they have stress, or any other mental issue, because of how the society label the people with mental health. So it starts with us recognizing, like, if there is any change in us, to be like open to ourselves first, but then not to afraid to seek help. And also the awareness should be on how to educate the communities that anyone can be depressed, anyone can have mental problem, because of the society that we live, because the nature of our environment. So it's not like you're not labeled as lazy or possessed, as I said before. And also we can create the environment of the discrete environment of, like, you can have those symptoms of mental problem, and only you and your doctor knows about it, because some people fail to go upfront and say, I'm not feeling well, my mental health is affected, just because they ask themselves, like, what if all people in my community know that I'm crazy, or I'm somehow not okay in my head? So I think it starts with us, but then it goes with the whole community. If the community has enough knowledge, and they are aware about the mental problems, mental health, how is it, that any of us can get it, and it's okay if you have it, because you can get a cure, like you can get a therapy out of it. It's important to continue educating the society, the community, because it's a journey. It's a journey.
Thank you so much. And how can we stop fake health information from spreading and share the light facts?
Okay. So when I was sharing the presentation, I put an emphasis on the verified health information. So even if we collaborate, like, the community leader can be a part of a certain intervention, educating the communities on a certain health intervention or a certain health issue. But then the basic information must come from the doctor, or from the health facility. So it can be in a written form, in a recording, so that we cannot endanger our society, our communities, because our goal is to improve the health. But when the information about health is wrong, and then we put our health, the community health, in danger. So by saying a verified health information,
Okay.
I mean the information must be from the doctor or a health facility that is certified to provide a health information.
Thank you. And where can we find money or resources to prepare our community for emergencies?
Okay. It all revolves around collaboration, because I mentioned government, I mentioned NGOs, I mentioned private entities, organizations. So any of them, like the government can invest in a certain intervention, health intervention, and the NGO can do the same. So both of them can provide funds to do a certain health intervention in a community.
Okay. How can we keep our communities calm and working together during a healthy crisis? Like earlier you mentioned about Ebola. So how can we keep our communities calm and working together during a healthy crisis?
Okay, so sometimes it can be hard because talk about Ebola, it's a disease that spread. Maybe we take an example of Corona. It spread. It's an airborne infection disease. So it might be a challenge, but we said a healthier community starts with us. There are community volunteers. There are like CHWs, community health workers, but they might not be enough because you might find in a community, let's say there are 100 households, but then there are only 20 health volunteers or health CHWs. There are few, but most people don't participate in community works in health area just because they're not giving enough education, enough training to do the activities. So I think we can, the government and the NGOs with collaborating with each other, they can invest in training those people that will be ready to educate the community. Because I might be ready to work in a community to spread the awareness, health awareness, but then I don't have enough education to do so. But when the government and the NGOs and the private partners come together and invest on training those people that will be ready to participate in educating other people in the community, that will make them like feel like the urge to be part of the community serving. Yeah.
I'll get back to healthy crisis again. How can we keep our communities calm and working together during a healthy crisis?
Okay, how to keep our community safe? You say
Calm
that,
and
yeah?
working together. How to
Okay.
keep our communities calm? Yeah.
How to keep our community safe or calm?
Calm and working together.
Okay. I think it's a matter of communication, but not only communication, communicating them about detailed of wherever that health condition is prevailing at the moment. Let's say now there's an outbreak of a certain disease. In order to keep the community calm, it's when the community has enough information about that health condition or disease. If they don't have the enough information, then they will start panic. If they have enough information, then they will be like, they will feel safe because they know what to do. And then they will be willing to collaborate because they have the enough information about what's going on, why is it there, and how to get to protect themselves against it.
Thank you. How can we deal with casual practices that might make managing an outbreak harder?
Okay. It can be very challenging because we are in the community that most of of the communities practice the cultural beliefs, like most communities believe that vaccine cause illness instead of preventing them. And most believe like mental health issues are a sign of weakness or a curse, or drinking herbal remedies can cure all the diseases. So the important thing is to tackle this myth by a clear evidence-based information, that to educate the community that, okay, there's these cultural practices that you believe in, but these health interventions are much more precise than the cultural practices. So yeah.
Thank you. What can we learn from past healthy crises like Ebola and coronaviruses in the past to improve how we respond in the future?
Okay, I think we can learn a lot from the past practices. First, we can learn that there's a power to the communities, the major power in make or breaking something. I mean, in the first, community had no clear or enough information about the disease. So most communities in the world panicked. But then later on, people started to to be educated on the best practices and how to stay away from the disease. So that makes a lot more easier for the community to be away from the disease, like the quarantine things, and to use things to strengthen the immunity. So yes.
Can you share one message to the audience as we are winding up?
Okay. What I can share with the audience today is let's work together to make health empowerment a reality for all. Like togetherness, the collaboration is all that we need, because it's not a one size fit all. So each community will learn from the other, but we cannot, as an individual, like a government alone or an NGO alone, or the community health workers or an individual alone cannot bring all the health goals that we have. But if we collaborate and work together, and then we can make all the reality that we have in our minds about health come to life.
Thank you so much for sharing your insights today. Your thoughts on healthy and the work being done are truly inspiring. Thank you again for joining us and contributing to this important conversation. And now I want to call Mama Mahini to speak to us.
Thank you so much for listening, guys.
Thank you.
Thank you so much, Shamira. Thank you so much from all of us. We would love
Yeah,
to hear your expertise again in 2025. We will be annoying you for like a lot of times.
Yes. You hear more about me lately.
Thank you, Shamira. Thank you so much,
I
Shamira.
hope you learn a thing or two.
We definitely have. Thank you so much, Shamira. Thank you.
Thank you.
Thank you, everybody, for joining in. We will continue a conversation on the WhatsApp.